dear students. I am Dr. R.K. Singh, Associate Professor, Department of Geography, TD PG College, Jaunpur. As we have discussed in our last lecture, the origin of mountain, particularly the plate tectonics theory. I hope you have gone through that theory. Today we will take a very new topic about coronavirus, COVID-19, the pandemic which is threatening entire humanity, and it has very dangerous aspects. In our country also, it has taken a very grave situation, and up to now, more than 2 lakhs cases have been forward, particularly in few states like Maharashtra, Delhi, Rajasthan, Tamil Nadu, and of course our Uttar Pradesh. Mumbai and Delhi, Chennai, these are the metropolitans which are worst affected by COVID-19. Casualty has also come over 10,000, and where it will stop, we just can't say anything about that. Different countries are doing various research work to get some vaccines. They are also experimenting on various medicines. As of now, few medicines like Favipiravir, Remdesivir were put forward by some countries. They are working on these medicines. In our country also, by Ayurveda, we are trying, and in Pune laboratory, in collaboration with certain foreign companies, we are trying to get vaccines or medicines immediately. So first of all, we'll come to the fact that what is coronavirus and what is the difference between COVID-19 and coronavirus. Coronavirus is quite, it has been observed from many decades. Coronavirus creates different type of problems, and before this COVID-19, we see that SARS and MERS like diseases were also came into existence due to coronavirus. SARS, which came in China, and MERS, which affected Middle East, although were dangerous, and mortality rate were quite high in both these diseases, SARS and MERS, but COVID-19 is creating some very serious concern for the humanity. It's a pandemic, and the last serious pandemic which the world observed was some 100 years back in 1918, when Spanish flu created havoc, and more than 5 crore people were dead due to that pandemic. And after that, it is after 100 years after that pandemic, now coronavirus has also creating very grave concern for the humanity, just as Spanish flu created. COVID-19 is a new name given to coronavirus because now it has mutated itself in a very different proposition. And regarding its origin, some people say that it is originated from the market, from the flesh market of Chinese city Wuhan, and due to it may be said that it is spread because of bat. Some people say that bat is the main source of this pandemic, and some people say that it is made in the laboratory. We are still not confirmed about that. That it is it is originated from animal or it has been created in a lab, but it came into existence around December 19, and that is why it has been called COVID-19. It originated from China. So let us see what are the different aspects of coronavirus. We will discuss in this lecture that what is coronavirus, how it is affecting humanity, and what are the precautions we have to take, and what will be the after effects of coronavirus on humanity and how it will go. We will see all the aspects, all the aspects in this lecture. So let us see. What is COVID-19? COVID-19 is a respiratory illness caused by a type of virus called a coronavirus, because it mainly affects the respiratory system of the human beings. First, it affects the nasal tract, and when the symptoms are more severe, then it affects the respiratory, and in the most serious cases, it affects our lungs. So when the infection goes towards the lungs, it is responsible for severe type of pneumonia, which proves very fatal for the human being. One other major cause of death in this disease is cytokine storm, and that is the response of the immunity system. Due to attack by this virus, our body produces cytokine storms, and which affects the organs of our body, some important organs like kidney, liver, which are affected, and people die because of multi-organ failure. So we can say that this disease, COVID-19, is causing very serious and grave health concern. This novel coronavirus, COVID-19, was discovered in China on January 31st, 2020. Health and Human Service Secretary Alex M. Azar declared a public health emergency for the United States. So COVID-19 was first discovered in China, and later on WHO declared it a pandemic. So here is a chart comparing coronavirus. Here we see novel coronavirus, COVID-19, Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, that is SARS. COVID-19 was first diagnosed in Hubei, China in December 2019. And then MERS, which was first found in Saudi Arabia in September 2012. And SARS was first found in Guangdong, China in November 2002. Although mortality rate was highest in MERS and second highest in SARS, and as compared to both these diseases, mortality rate was quite lower in COVID-19. But main problem with this disease is that it is highly infectious. It is more highly infectious than both these diseases. Origin of COVID-19 is unknown. Some people say that it has been originated from a lab of China. Some people say that it came from bats, and there are many other theories also. And MERS was supposed to be originated from camels and bats, and SARS was supposed to be originated from cats. Incubation period of all the three diseases, COVID-19 has incubation period of 1 to 14 days. Virus may spread before symptoms show. MERS incubation period is 2 to 14 days. Virus may spread before symptoms show. And SARS incubation period is 2 to 7 days. Virus is spread after symptoms show. Common signs of infection in COVID-19 is fever, cough, shortness of breath, and diarrhea. While in severe cases of SARS and MERS, symptoms are pneumonia, severe kidney, acute respiratory syndrome, kidney failure, and death. Even COVID-19 also have all these serious symptoms. And till now, no vaccine or specific treatment available for all these three problems. So now again some facts about COVID-19. Novel coronavirus are viruses that circulate among animals, but some of them are also known to affect humans. The 2019 novel coronavirus was identified in China at the end of 2019 and is a new strain that has not previously been seen in humans. As far as symptoms of COVID-19 is concerned, main symptom is fever, cough, difficulty breathing, muscle pain, tiredness. Now, what are the preventions? Avoid contact with sick people. At least a distance of 10 to 12 feet is mandatory. Avoid visiting markets and places where animals are handled. Avoid contact with animals, their excretions or droppings. Wash your hands with soap and water. Apply general rules governing food hygiene. In this map, we can see the areas all around the globe, the countries which are worst affected by this pandemic. Here we saw China, which was originally worst affected, but now it has far behind from other countries. China is now, I think, is on 15th position, and now US is leading the list with coronavirus patients, and it has more than about 20 lakhs cases now, and casualty is more than 1 lakh here in USA. USA is the worst hit by coronavirus till now, and some European countries like Italy, Spain, France, United Kingdom, these countries were also worst affected, but now situation is improving here. As of now, one of the worst affected country after USA is Brazil. Here the total number of cases are reaching 1 million very soon, and in Russia also we have more than 5 lakhs cases of now. India now is among top 5 countries, and India is also rising trend of coronavirus patients, and now we have more than 3 lakh patients in India, and some states like Maharashtra, Rajasthan and Tamil Nadu, Uttar Pradesh, Gujarat are worst affected areas. Some countries like South Korea, Thailand, Australia, which were quite affected in the early period of pandemic, now they have somehow controlled the situation, and in all these countries, New Zealand has declared himself free from coronavirus, and Australia have also come down on normal way of life. And now the Latin American countries like Chile, Peru, these are getting worse and worse. And India is also having serious problems with these after the opening of the market and some other activities. Now patients are increasing in very high number every day. More than 10 to 12,000 patients are coming each and every day. And by July, it has been expected that the total number of patients will come around 5 lakhs people, and it is proving very difficult to control this problem in India. And this is the death figure of selected countries, showing the number of deaths since the day of the first one using a log scale data correct at 6:29 UTC 19 June. Here the worst affected country is US, Brazil, UK, and you see the graph of Spain, France, Mexico. Here is Russia and Germany, and this is China, which has flattened this curve now, and US and Brazil, UK are still going upward. Australia and Japan have somehow been able to control this disease, and it is on the lower side of this curve. So this is the situation right now. And now the COVID-19 mortality rate, no underlying conditions. Patients with no underlying condition is shown by blue, and patients with underlying condition are shown by red. So here we see these are the age groups of the people. Persons with age group of 0 to 9 years, this is 10 to 19 years, this is 20 to 29, this is 30 to 39, and so on, 60 to 69 and 70 to 79 and 80 plus. So persons with underlying situation, underlying other diseases, have the highest mortality rate in the people age group of 80 plus. Here they have mortality rate of 31%, and person without underlying diseases have mortality rate of only 9% in 80 plus age group. In the same way, if we see the age group of 70 to 79, person with underlying diseases have mortality rate of 20.5% as compared to persons without underlying diseases have only 2.8% of mortality. This is all shown in all these age groups here. One thing is also remarkable from this chart is that we have very low mortality rate up to, you can say, 40 to 49. It is only that above the age of 50 years, the persons are more likely to have serious outcomes of this disease. So this is a very important, that how we have to be very careful about our elders. And sometimes after going through this graph, we can say that sometimes younger people go outside to the market and bring infection to their home, that proves very, very dangerous for their elders. So I will request you, my students, so to not to go outside home and bring infection in your home which can prove fatal for your parents and your elder ones in the house. So take this very seriously. So again, here is showing what precautions to be taken. Wash your hands by a sanitizer, or you can use soaps. Whenever you go out, or have something from outside, people go to take vegetables, milk, and necessary items for their household. So whenever you touch anything, just come and wash your hands and sanitize your hands properly. At least washing of 30 seconds is essentially required for this. Use a tissue for cough. At the same time, use proper mask. It has been mandatory by WHO and our government that you have to wear mask, and without mask you just cannot go outside of your house. Even penalty is laid by our government so that no one could go outside without masks. And about touching your face, whenever you go out and touch something, keep in mind that you have not to touch your face, because coronavirus is spread basically through your noses, through your mouth, and through your eyes. So you have not to touch by your hand. Suppose your hand is having infection and you touch your face, eyes or mouth, then it will go inside and create problem for you. So you have not to touch anything, and particularly your face. This is here, mask is shown, how to wear mask. You have to take proper mask, which is 3-layered mask, and put it properly, in which your nose are also covered, so that some people have mask on only mouth and open their nose. That is of no use. So you have to take a good mask. It is not necessary to have any costly mask, and you can use homemade mask also, but it should be 3-layered and it should be properly fixing on your face. And you can also use gloves whenever you go outside and touch different surfaces. Then you can use gloves, because it has been said that on different surfaces this coronavirus can exist for many days. As for wood, it can survive for 72 hours. On metals, it can survive for 2-3 days, and some people say that in air it can circulate in a closed room where you have an centralized AC system. This virus can circulate for hours and can affect many people. So we have to use gloves, but whenever you come back to home, you have to throw these gloves immediately. Either dispose it off or wash it. And then if it is a plastic glove, then wash it first and then use it for the next time. And while wearing gloves, don't touch your face, because virus can be on the gloves also. So if you touch your face by those gloves, then the virus can be transmitted to you. And here you have to clean the surfaces, you have to sanitize the surfaces, because that can be infected. Social distancing is very important, since the markets are open now and you have to go and buy things, and we have seen that even transport systems have been open. Some trains have been allowed to run, some buses have been allowed to run. So whenever we go, we have to stand on the signs made for you in a queue. So we have to stand on these marks only, and we should maintain a distance of at least 6 to 8 feet. Try to make distance of 10 feet, but 6 feet is very important. Before 6 feet, you just cannot go to someone. So use social distancing, it is very important. If having symptoms, if you feel like cough, fever, sneezing, dry cough, then and pain in the body, if you experience such symptoms, then you have to contact your medical practitioner, you have to inform the doctors, you have to download the app provided by the government, Arogya app, so which will make you alert of the person having symptoms around you. So you have to contact doctor, testing to be done, isolate yourself when you are having these type of symptoms, isolate at home, and if you are having some serious symptom, then go and hospitalize and get yourself checked and get proper treatment through the specialized doctors meant for these diseases. So friends, dear students, I will request you all to take this disease very seriously. This is a pandemic. This can create problem for you, and this pandemic is not only affected our life, but it will affect us for a long time. It will entirely change our work culture. One of the impact of this disease is that now I'm talking to you on this online platform rather than teaching you in the class. So now we have to make social distancing, and many other things will change. I think for a long time, for a year or two at least, in which we have to work in a very different atmosphere. We have to work from home. We have not to gather in a crowded places. We cannot travel in trains and public transport system, and a lot of people are going to be affected by this. We have seen the example of migrant workers who have lost their jobs in metropolitan cities, and now they are coming back to their villages, and they have been now unemployed and they have no source of livelihood. So government is trying to create jobs for them through Manrega and through different other schemes are going to be launched by central government and state government. So the entire scenario is changed and is going to be changed in the coming period. So we have to reciprocate with the situation, and with ultimate and firm determination, we'll try to come out of this situation. Thank you.